I'm visiting Dr. Jason Plyman today. We're going to talk about something that's fun to say but not fun to experience, which is an Achilles tendon injury.
Yeah. Achilles tendon injuries are not fun. As fun as they may be to say, they can really happen at a moment's notice when there's no precursor of symptoms, and when they do, they can derail people for quite a long time.
Is an Achilles tendon injury, is it something that can just happen randomly, or as we're being active, does the Achilles wear down through time?
So we think that probably as we age, there's a gradual decrease in some of the vascular supply to the tendon that may put it at risk. And there's probably an age at which if your level of activity is high enough and your tendon is starting to deteriorate, it puts you at risk to have it tear. And there's a variety of types of injuries to the tendon. Some are more chronic, like tendonitis and inflammation, and then there's others that are more acute, like an Achilles tendon rupture, where the tendon actually tears.
And we talked to a patient of yours, Brandy Goddard, and we know Brandy lives a very, very active lifestyle. She actually came to you because she tore her Achilles.
Hi, I'm Brandy Goddard, and I did have a massive Achilles surgery. But before I had surgery, I had a really bad Achilles tendonitis for about 2 years. I competed in a competition called Tri-Fitness Challenge. I did that for about 10 years. In the meantime, I started, getting some pain in my Achilles, which I think it was more in my calves. So from there, I was offered the opportunity of trying out for American Ninja Warrior Show. And so then I went to an outdoor obstacle course, and I jumped up this wall, but as I walked, you would think the foot on the wall would pop, but it was the foot on the ground, and it went pop. I knew it. And guess what? I was so glad. I just tore my Achilles. And luckily, my neighbor was Dr. Plyman. So I called him, and I don't think he was surprised, but luckily he let me borrow his son's boot just to kind of get some relief. He decided I need a full repair for my Achilles. But this time, I decided to do the rehab completely right. And it's a long recovery. Not many people my age do what I do, but I do believe having that type of surgery, doing the rehab, and going back to what my body knows properly has helped me, kind of be where I am now.
Now, she had the surgery for the Achilles tendon injury. Can you talk about that? What's that process like?
There are options to treat those non-operatively in people that are less active. There are ways to treat it non-operatively in active people as well. But in her case, she elected to proceed with surgery, and that involved an outpatient surgery to essentially sew the tendon back together. That can be done in a variety of ways. You can do it through a standard open incision. We can also do it through a very small incision that involves less dissection, and some of it depends on the type of rupture that occurs. But Brandy had hers fixed, and I guess as you probably have seen, she's doing pretty well.
Now, you mentioned non-surgical ways to repair. What are those?
So there are, in issues that are more chronic or less acute, where there's tendonitis and inflammation in the Achilles, then we can treat that with a period of immobilization in a boot, physical therapy. There are medicines that we can use to help with inflammation, but most athletes choose to have these repaired.
Dr. Plyman, what does recovery and rehab look like?
Typically, there's a period where you're on crutches or on a knee scooter, not putting weight on it, for 2 to 4 weeks. And then generally you can walk in a boot for several weeks after that while we start physical therapy. The difficulty with Achilles tendon ruptures is, even though we repair it and sew the tendon together, before we can really put normal stress on the tendon actually has to heal, and that can take a very long time. And in some studies, it would say it could take 9 to 12 months before that tendon achieves full strength. And so there's lots of physical therapy involved initially to regain range of motion, because we're immobilized for a period of time. And then as the tendon continues to strengthen in its tensile strength, and we also want to strengthen the calf muscle and the lower extremity muscles.
Dr. Plyman, thank you so much for talking with us today. We appreciate it.
Thank
I
you.
Clearly need to make sure that I get to stretching. I definitely don't want to tear my Achilles, or else I'll be coming to see you, Dr. Plyman.
I hope I don't have to see you there.
We'll have our Good Day at WA right after this.